Welcome to Smut, did you say? Hosted by Nurse Nikki in association with Queerlana. Before we begin, please note that the views and opinions expressed are those of the host and guests and not necessarily Queerlana as a whole. This podcast is for educational and resource purposes only. It is not intended as medical advice, legal advice, or a substitute for professional care. Because of the nature of healthcare work, we may discuss heavy or sensitive topics, including mental health struggles, suicide, sexual assault, death, or violence. Listener discretion is advised, and this podcast is recommended for adult audiences age 18 and older. If you are in crisis or need immediate support, please reach out to a qualified professional or call your local emergency number. Okay, on to Nurse Nikki.
All right, girls and gays, ladies and gentlethems, it's time to answer Smut Did You Say, where we'll expose ourselves to uncomfortable truths, plow into some pillow talk, and get those burning questions looked at. I'm Nikki, she, her. Today's guest is Dustin. Please introduce yourself and tell us what we're talking about.
Well, hi, everybody. My name is Dr. Dustin Bass. I am a nurse leader and have been a nurse and nurse leader for about 15 years. And we are going to talk about my journey into being a gay nurse leader.
Yay. I like how you just Dr. Dustin Bass. I love the ring of that. So I'll just kind of give a little intro on how I got connected with Dustin. I took a job with an organization and he was the assistant vice president of that organization. And I was really hoping to get more, of the facility of that or whatever. Anyways, he was an assistant vice president. And I was at a point in my career where I really, really wanted to learn more and just get more skills under my belt, but not just clinical skills, but like growing as a better nurse. And I had told this to my manager at the time, who was one of the managers underneath Dustin. And I just kind of said that I wanted to get more involved in some things. And she was like, do you want to go to this conference that I can't go to? And you can just like take my day. And I was like, yeah, I would love that. And I don't remember who the first person I heard talk was. It was like Jean Prohl or something like that. Like somebody amazing, because it was SESS. And I was just like, oh my gosh, these people are obsessed with learning and healthcare as I am. And I just left that conference just like beaming. And I didn't even like travel anywhere. Like that was the one that was in Charlotte, So I just drove down to a hotel and like listened to some people like share some amazing stories about nursing. And then you came out with this opportunity to basically a free ride to go to the ENA conference. And I was like, I totally want to do that. You did this AVP roundtable where people from different hospitals that you work for could kind of come and talk about different barriers that we might be having or different things. So you're just a huge inspiration to me. And also, being in the queer community as well, it's one of those things that, when you see yourself in other people, because I'm like, you're clearly super passionate about learning. You're super passionate about advocating for not only other nurses, but also for members of your own community. And yeah, so I just wanted to give that little spiel about how I know Dr. Dustin Bass.
Oh my gosh. Oh, that's very flattering. Thank you.
Well, yeah, but I really mean it. We're people, and as nurses, we have to advocate for literally everybody. It's professional ethics, and it's just being professional and following the ANA Code of Ethics. And the ENA has put out so many amazing statements. I know Dawn, I met her at SCSS, the Canadian one.
Yeah, Dawn Theta.
Yeah. And she's written a lot of position statements that I've actually used in my master's program. And then, and then to see Lisa Wolf's name on things and just knowing all these amazing nurse leaders. And then, being able to see just little things like Happy Pride Month. And you guys continue putting those things out there. Ryan continues putting out things about advocacy for people. And, I see things coming from you as well. And it's really nice to be part of an organization who isn't going to back down,
Yeah.
because we're in this space in this country where a lot of people are backing down, But I just don't really see ENA doing that.
No, it's a different time, right, than it was even just a couple years ago. But I think that, to your point, everyone's still a human being
Yeah.
regardless. And as nurses, my hope is that you got into nursing because you love people, and regardless of who they are or what they are,
And you're
you're
gonna love
gonna.
some people more than others, and that's fine.
It's true, and that's okay, right? And I think that for me, I also hope that my journey and the things that I've done can inspire other people,
Yeah.
you know? So,
So where did you start?
uh,
Where did it all
wow.
begin?
So, a lot of people don't know this about me. So, my dad is a West Virginia coal miner.
Oh, wow.
So, I am the, yeah, so I am the first in my family to go to college.
Okay, I
Um,
really did not know that.
Yeah, I'm a first generation college student. And then my real mother died whenever I was 12. So she was murdered. It's a big long story that we could do a whole nother episode on, but we're
Oh
gonna
my
move
gosh.
past that. I had a lot of really great therapy and a lot of really great support that has got me to where I am today around that and being able to process it and use it in a positive way.
Mhm,
Um, and then I have a really great stepmom who came into my life whenever I was 16. But it's interesting because whenever I was 16, I got the opportunity to volunteer at a hospital
mhm.
called, and I remember walking into that hospital and they said, "You're going to go down to the emergency department." And I was like, "Really?
Yeah.
Okay." I think I was a little terrified.
Oh, aren't we
And
all? Like, if you've
yeah,
never been in the ER, like,
right.
just even as a patient the first time in the ER, it's
Yeah.
terrifying. It's
Yes, it
terrifying in there.
really is. And we had a cheer cart. So it was this little cart with coloring books and crayons and sodas and maybe some snacks. And so our job as volunteers was to go around the waiting room and, pass out that kind of stuff from the cheer cart if they were allowed to have it.
I was gonna say.
Um, yeah. And so if they were patients, you weren't allowed to give them food, but you could give them coloring books. It was a whole thing.
That's nice.
And so whenever I was down there, though, I saw, just like any other moment, right? You see these emergencies that just happen out of nowhere
Mhm.
that no one is ready for, no one's prepared. It's not the code that called, it's the code that happened in the hallway.
Right.
And I saw an ER charge nurse literally jump on a stretcher and start doing CPR and it get rolled down the hall. And I said, I want to be her.
Right? Like, isn't that you're just like,
Like,
"Oh, when do how do
yeah.
I learn how to do that? That's
Right. I said,
awesome."
"She is a badass. I wanna
Right.
be her." I don't know if
Right.
I can say that, sorry.
It's
But it's just like, I was like, "I wanna be her." Like, she is it. And her name was Greta, which
Mhm.
sounds hardcore anyway,
Right.
right? And I don't even know where she is now, but she really did inspire me to say, "Well, what does that look like?" And on the other hand, my real mom had always said, "Hey, you're gonna be a doctor one day. You're gonna go to an Ivy League school one day, believe it or
Yeah.
not.
Mhm.
And you're so smart, you gotta do this." And I was like, okay. So I had these two things kind of in my pocket. And so my first degree is actually in biology. So I got a bachelor's in biology from what was Mountain State University, which is now West Virginia University,
Mhm.
because West Virginia University bought Mountain State. But I got a bachelor's in biology. I graduated and thought, you know, I don't want to go to medical school.
Yeah.
Like that seems like a lot. And I had saw my cousin who he's a physician now, and I said, I don't want to be in school that long. I don't think I want to do that. I was on my own at that point. I had
That's
moved
cute.
out.
I don't wanna be in school that long.
Right.
How many years have you been in school?
Right. I know. I mean, it's just crazy, right? But at that point I had moved out
Mhm.
of my parents' house. I had a partner that I had been with for about a year. And then I started college. He was 10 years older than I was. And so I really only
Mhm.
lived on my own for about 6 months and then moved in with him. And, he got me through college, helped me. We had a great relationship. And then I got my bachelor's in biology and I thought, okay, I don't want to go to med school. And then I randomly applied to a nursing program. I don't even know why.
Yeah.
One nursing program.
Right.
I looked at the requirements and I met all of them except needing to take the TEAS test. So I went and took the TEAS test. I've always been a good test taker. So I just took it and applied, got in, and I thought, wow, I guess I'm going to do this,
Right.
you
Yeah,
know,
so
and it,
when you start nursing school with already having a bachelor's degree, it's pretty easy to get in. 'Cause, like,
yeah,
for North
I didn't know
Carolina
that,
I didn't
but
either. So, I knew I always wanted to be a nurse, but I didn't want to dedicate my life to that soon because I was, like, 17 when I started college. So,
yeah.
I was like, "Well, I'll get a degree in biology," and then I'm really bad at math. So, I got a degree in kinesiology instead. But so I had my bachelor's degree already, and then I'm like, "Well, where am I gonna go to nursing school?" And then, at the time, there wasn't a nursing shortage because it kinda comes and goes, And then, my cousin lived in North Carolina already, and she was like, "Yeah, you basically just have to take the TEAS test because you have all these points already." I love that you were kinda just like, "Yeah, nursing school, I'll just throw my hat in the ring, and then,
See
I
what
guess I can
happens.
do this." Yeah. Okay, sorry, go on.
I distinctly remember like telling my neighbor about it, and
Mhm.
her and I had become friends, and we were at the grocery store in the yogurt section, and me just randomly being like, I applied to nursing school, and she was like, what? And I was like, yeah, we'll see what happens. And then I got in, and
What were you gonna do with your biology degree? Did you not know, or did you have an idea?
I really didn't know. I thought PA school, and then I saw the nursing school and thought I'll apply there and see what happens, right?
Yeah.
And so whenever I got in, I thought, okay, well, I'm going to do this. And so August of 2010, I started nursing school at Mercy School of Nursing, which was a diploma program. It's not even around
Yeah, I
anymore.
was like, it
So
doesn't even exist anymore. They just
yeah,
have classes over there, like
yeah,
like,
yeah.
um, work classes.
Yeah. So I went through and got my diploma in nursing. I worked the whole time except for the last semester through nursing school. I was a service and catering manager. So I got a job with Wolfgang Puck doing catering and things like that. And so I was able to work that job and then go to nursing school except for my last semester, which was really interesting. And then that was back in the day when just because you went to nursing school with a school associated with a hospital did not mean you were getting a job. And
Yeah,
I know that that's crazy to nurses now because they're like, what do you mean? We
yeah.
have all these job offers. The people are dying for us to come work for
That's
them.
what I'm
And it was,
saying, like, when there wasn't a nursing shortage, it was, like, hard to get a job, and
yeah.
people do not get that.
So whenever I graduated in 2011, they only took half of our class.
Yeah,
So it was Carolina's Medical Center back then. They only took half of our class, and the other half we had to go find our own jobs. And
yeah.
I was one of the ones that, unfortunately, even though I was student body president and all the things, I did not get chosen. And honestly, I think it might have been the best thing that ever happened to me because I then had to go out and find my own job. And I got offered my first job in the emergency department at Piedmont Medical Center in Rock Hill, South Carolina,
And now you
which is,
can't even start your career in the ED anymore. You
ah,
have to do a year of somewhere else. I think that they're changing the residency program even to do a little bit in med surg first. Is that used to be a rule, and then they took it away with the residency program, and then they brought it back after COVID, and it's just been kind of everywhere.
yeah, it's a back and forth thing that happens, and
Yeah.
but back then, there was only 3 of us that she hired as residents, and
Yeah.
back then they didn't even have residency programs, right?
They
This
were
was like
kind of
a
doing it already.
yeah, this is a pilot, it was new, it was, they were like, "We don't know how this is gonna work," and honestly, only 2 of the 3 of us made it, through the program, but it was 6 months of orientation, I had a really great preceptor.
And
Her
that
name was
makes a
Kath.
huge difference too.
Oh, yeah, she was awesome, and her name was Kathy, and Kathy was just amazing. She taught me a lot, right? She'd been a nurse for 20 some years, and I just remember I learned so much, but then even whenever I got off orientation, you're not ready.
No,
You're
never
never
will.
ready.
Yeah.
Um,
And
you
6
cry the
months is
first
a
year, and
long
that's okay.
orientation because when I was in my residency program in 2018, there were nurses being like, "What do you mean you're on orientation for, like, 6 months?" And I was like, "Well, I can do a year if I want to." And they're like, "That's insane. I only got, like, 6 weeks of whatever." And I was like, I mean, they're trying to make us better nurses. They're trying to make us stay longer, like,
Yes,
I think it makes a big difference.
it does, right? And so that's my journey to nursing and how I really got started in the emergency department, and interestingly enough, the same time I got started in the emergency department, I got started into ENA.
Really?
Yeah, I always wanted to be an ER nurse. I thought I wanted to do critical care for sure. And then whenever I got that job, I was really excited. And it just so happened my director of education at Piedmont was a past president of National ENA, and
That's
he got me,
awesome.
yeah, and he kind of said, you should go to an ENA meeting and see what that's like. And I was like, okay. And so I did, and I fell in love with it.
I think
So,
if I had started in an organization that was bigger on making sure that nurses had more education, like, outside of, like, the clinical, I think I would have been set up a lot more for success, just honestly because I feel so supported with the nurses that I've talked to and just the experiences that you hear, and then with me being the weirdo that wants to ask questions all the time, I love how passionate they are about the topics that they teach, and I always hated those classes, the nonviolent crisis intervention. They're like, like
right.
teaching a
Yeah.
class, and it's important, and then,
Hmm.
the classes that you taught, your perception is everything, and your,
Oh, yeah.
yeah,
That was a
and
good one.
yeah,
That's a good one. I
things
still
like
teach
that.
that class.
Yeah, but, those classes, those were things that you were really passionate about. They were projects that you put together in school or on your own time or whatever, and those were things that you poured yourself into, and when you listen to people speaking at conferences, these are things people have really poured themselves into and either taking their very little free time or just working on it for a master's degree or for a clinical ladder project or something like that. Like, if you're if you're going to present something, you should be passionate about it, in my
Agree.
opinion.
I agree.
So
Oh,
I think
1,000%.
that in my first, like, 5 years as a nurse, if I had been more involved in like things like the ENA, I just think things would have been better.
It was, I mean, it was good. It was good for
And you
me.
guys are
It
all a
really
bunch of
was.
weirdos, and I just love that. Like, ER nurses in general are just a bunch of weirdos, but then the ones that are like the learning nerds, like, you're definitely a bunch of weirdos.
Yeah,
So
we are.
Gina goes to bed to like murder stories, like
Oh,
those
yeah,
are her
I did
like
too.
lullabies. Yeah,
Yeah.
like we're insane. And then to have people like us in your corner, as a minority group and stuff like that, it's just it's even more because the ENA does not abide discrimination at all, like, at all. It's all over the place. Like, their advocacy page, the things that they say, the things that they put out, their position statements. When you get involved in that organization that you're part of something that it it
It's a
means what it says.
community.
Yeah, and it's a community, and
Yeah.
they want you to they want you to succeed, and they have projects like the Endeavor Project,
Mhm.
and they do scholarships and grants and stuff like that. So you started nursing, you had a really good start. You're 6 months in with your preceptor, you get involved in the ENA, and then what?
You know, to your point about ENA, it really is a community, and community, in my opinion, is where you find strength, and
Yeah,
we're stronger together, and that beats the alternative every time, right? So ENA in itself is its own community, and then our community, right?
yeah.
As a gay nurse leader, as a gay nurse, I think is also a community in itself that we have to think about, and you can rely on actually. But so after that, I mean, I worked in that emergency department for about 4.5 years. I did various positions. I was promoted to charge nurse, I think after about 2 years. I had to move to night shift to be a charge nurse, but I really wanted to do it. I know. So I went to night
Surprised you didn't
shift.
start on night
I
shift.
know. I went to night shift and they promoted me as charge, and I was running around like moving people. We saw 200 and some patients a day, and it's
Oh,
23
that's
beds.
ugh.
Like, it was insane. Yeah, that
Yeah.
place is crazy.
Was
And
that in West Virginia?
it was in South Carolina.
Oh,
South
South
Carolina.
Carolina, okay.
Yeah, Rock Hill, South Carolina. Yeah. And then I had a patient. I was charged. I had a psych patient who came in. Of course, we didn't have a room, so I put him in the consult room out there. And then he tried to hang himself with his t-shirt. And that was back before we undressed everybody,
Yeah,
right? We didn't do that. And
yeah.
so I, at the time, and my leader, she was a director, instead of telling me, "No, you did a bad job," she came to me and said, "Hey, obviously this is a process problem and you're going to fix it." And so she gave me the opportunity to rewrite the entire psych policy. And so I like did all this research. I rewrote the entire psychology policy for the ED. And I will tell you what, some of the things that I wrote are still used at Tenet Healthcare
I
in their
love
policy,
that. Oh,
which is
that's
crazy.
awesome. Yeah.
Crazy, right?
So many things do change, but some things
Yeah.
are just pillars, you know?
Yeah. I mean, I was one of the first ones in Tenet. Now, I'm sure people were using this before, but the first ones in Tenet to say we should use the Columbia Suicide Scale, right?
Yeah.
And this is how we could tell. And we had this huge packet that I made. You had to take out an envelope and do
Oh,
this huge
people
psych
loved
packet.
you,
Like,
I'm sure.
oh
They were
my
like,
God.
"Oh, jeez.
They were like, this
Got a
paperwork.
psych
And I
patient,
was
now
like,
I have to do
well,
this whole thing on
yeah,
paper."
yeah, they did. We didn't have it in the chart,
Yeah.
so you had to do it all on paper. Um, Like all those checks and the environmental checklist and the rounding, all of it had to be documented on paper. So,
Yeah.
because of that, though, I got promoted to a clinical supervisor, which is equivalent to an assistant nurse manager, depending on where you're at. Titles are different throughout the nation, I've learned,
Mhm.
but you can pretty much tell like where the equivalents are. And so it was more so clinical supervisor, assistant nurse manager kind of thing.
Yeah, where
Um,
you're, like, still on the floor as a charge nurse, but you have managerial duties.
yes, yeah. And
And
so
that
that's what
means
I did.
night shift has contact with management, which other places that don't have clinical supervisors, you're like, "I don't even know who my manager is. I don't know what they look like.
Right.
I've never seen them."
Yeah. Yeah. And so I was promoted to clinical supervisor and then I kind of fell in love with leadership then whenever I was able to see myself write this policy and make a change and it work
Mhm.
and it keep people safe and it give people direction. And that's whenever I was like, oh, I like this. This is
Yeah,
what I want to do. Because I've always just wanted to help people, right? But then I'm like, I can help people.
right.
Like, and that to me, having a larger reach, right? This exponential kind of effect from the things that you're doing
Mhm.
really, it got me hooked. And I was like, I love this.
Right.
And so I thought, oh, this is why I want to be a leader. Like, this is the reason. And so, of course, I do the thing that a lot of people do, or I don't know if they do it or not. I always tell people I mentor now to do it, but I find people that I admire on LinkedIn and then I'll go and stalk them and be like, so what was your job history? What was your, degree education history? How did it correlate? And like you can watch somebody's journey on LinkedIn, really.
Yeah.
If you just look at their profile, you can see like how they moved up in education and how they moved up in their career. And I thought back then I wanted to be a chief nurse. And so I would find chief nurses that I admired and just see like how am I going to get there? And I knew I needed a master's degree. But I also kind of knew then, because Tenet was a for profit organization, that I didn't want a master's in nursing. And the reason is because I saw the need for our nurse leaders to have the right tools in their tool belt.
Yeah.
Not saying that an MSN can't give you that, right? But for me, I wanted to have that background in finance and that healthcare administration background just like the CEO of the hospital had. Like the CEO of the hospital
Right.
has an MHA. Why don't I go get one?
Yeah, because they'll
And
they'll stop you and be like, "You don't understand corporate process,"
yeah.
and then you'll be like, "But I understand the part that's gonna get the patients what they need," and, but
Hmm.
yeah, I've heard that many times, "You don't
Yeah.
understand corporate process." Well, then tell
Hmm.
me about it. I mean, I'm not an idiot.
Right. You're right. So that was kind of that was my path is that I decided to get my MHA. And in that time, I also had this epiphany that said, Dustin, if you want to be a real influential nurse leader, you really have to go somewhere else. In my world, I couldn't stay in the same place, right?
Yeah.
And so I decided that while I was getting my MHA, I would travel
Mhm.
and I would be really intentional about traveling and travel to different places. I never stayed in one place more than one contract.
Yeah.
I literally did my 13 weeks and I left. And every time I was there, I would get close with the leaders and try to understand what their thought processes were, try to understand where their processes fell short versus where they did really well. So I would analyze everything while just being a bedside nurse taking care of the patient in the ER, right?
Yeah.
And so I was in New York, I was in North Carolina, in South Carolina, in West Virginia, in Florida. I did contracts all up and down kind of that East Coast. And I learned a lot and I met a lot of really great people. And simultaneously to that, I remained connected to ENA,
Hmm.
right? And so while I was at Piedmont as a charge nurse, I went to my very first national conference. And as
Hmm.
you talked about earlier, your first national conference is a different experience. It is amazing. Yes. I still remember mine. My very first one was in Indianapolis. And I remember standing there in GA, General Assembly, and just being awed at like, look at this. Like, this is how our profession is deciding like best practice. All these really smart people are in this room and they're leading our profession to a better place so that we can
Right.
help more people help people, right?
Hmm.
And I was hooked. I said, I want to do that. I want to do this. This is what I want to do. So simultaneously, I would stay connected to ENA and do various things. I was a chapter president in South Carolina, even though I didn't live in South Carolina the whole time. I did some, committee work and stuff like that. And then I finished my master's degree and I didn't even know what a headhunter was. Okay. And so these random people started calling me and said, "Oh, we have these management jobs open. Are you interested?" Like the minute I updated my LinkedIn after I finished my master's degree, it was
You have
there.
a master's degree. Come work for us.
Yeah. And so I remember getting this call for a job in Nevada and I interviewed on the phone, did all the things, and then they said, "We want to bring you out here and interview you." And I remember getting on that airplane and thinking, I am never moving to Nevada. I will come out here and talk to these people for a free trip to Nevada, and then
Right.
I'm coming back home, right? And I went out there and fell in love with the ER. I fell in love with the director. It was my first nurse manager job, right? And so I decided to take it. And I
Was that
picked up my
before or
life.
after the shooting in Vegas?
That was before.
Okay. So
Yeah.
they haven't
So,
had all those process
yeah.
changes and stuff from that.
Yeah. So that was 2016. I believe the shooting was in 2019.
Yeah.
So, um, what was I saying? Oh, so I decided to go. So I packed up my life and I moved to Nevada. And in my head, I thought I'm going to be here for 2 years and then I'm going to move on. And that's not what happened. So I got progressively increasing responsibility there. I was nurse manager and then I was promoted to the director and then the service line director, where at the end I had 3 urgent cares and 2 emergency departments in Northern Nevada.
Oh, wow.
It was, I mean, I had great mentors. Um, I had great mentors, great support. Like just, it was a good time and I learned a lot. And then simultaneously, I remained connected to ENA. I remember calling the state president of Nevada and being like, "How do I get involved?"
Yeah.
And and she was like, "Well, come to this meeting. I need help." And I was like,
Right.
"Okay." And so, of course, I got involved, and then ended up being the state president of Nevada for
I
ENA.
didn't know that. That's
Hmm.
awesome.
Yeah, I was state president of Nevada for ENA, and then I also simultaneously applied to the National Education and Planning Committee. And Jeff Solheim was the president who picked me and let me be on the committee for the very first time.
He's freaking
Yes,
awesome. I
he
have
is
his
pretty awesome.
yeah, I have his,
Yeah.
study stuff for the TCRN
Uh huh.
in the CPAT. I kinda fell off with that, but yeah,
Yeah.
I bought his stuff.
He's a pretty awesome guy. So
Yeah,
I
and I
used his
met him
stuff
at
to
the
get my
conference.
CEN.
I met him
So
at the national
did
conference
you?
too, 'cause yeah,
Yeah.
I was like, "Oh my god, you're Jeff."
So I was on his National Education and Planning Committee. So that's the committee that plans the conference,
Right, yeah,
right? And the president is, of course, the liaison, the board member in charge of that committee.
yeah,
And so he picked me and I was on there. I learned so much about how the conference ran and what it was supposed to look like and how to read abstracts and grade them and picking um the sessions and then mentoring the people through their sessions, getting everything in and all that stuff. So it was a little intense, but it was great. And so
yeah.
I was simultaneously like serving as a state office and on this national committee and I just kept like getting more and more involved in ENA. And
You really
it's,
don't like having, like, free time, do you?
I mean, I guess not. I guess I don't. I just
You're
was kind of
enjoying
like,
these
oh,
things, so it's like it's
yeah,
kind of like these are hobbies,
mm-mm,
but they're, like, actually work too.
right. It's actually like things. Yeah. And so that's what happened. I mean, that's what happened there. And then, you know, in 2019, I do remember the Vegas shooting that you mentioned. And
Yeah.
as the state president, I flew to Vegas, and that day I visited 10 different emergency departments. I think it was a couple months after the shooting, actually. And I brought cookies and resources and just was like, hey, I'm here because everyone, I'm always the guy that's like, I'm going to send my thoughts immediately after the horrible thing happened. But I also like to really put a lot of my effort into the time after, because what happens is you get that initial big response and then it all just kind of goes away. And
Yeah,
so
yeah,
then,
that's how COVID was. It was just like
right.
everybody was like, "Oh, we're gonna buy you food and we're gonna whatever," and that
Mhm.
lasted for, like, I don't know, 6 months.
Yeah. And so I remember doing that. And that was towards I think the fall of 2019 that I went down there, maybe late summer, early fall. And I visited all these EDs. And I actually have like pictures I was looking at the other day, like, wow, I remember doing that.
Yeah.
And then I also was like, okay, um, it was the end of 2019 simultaneously. And then Mike Hastings, I don't know if you know who that is.
The
Um,
name sounds really familiar.
he was the national president in 2020.
Oh, yeah, okay. Yeah,
So
because
in
they were like, Mike Hastings had a hard time with they
yeah,
didn't get to have a conference and they
he
didn't.
did.
Yeah, yeah.
So in 2019, I remember decorating the Christmas tree, and he called me and said, "Hey, I want you to be the co-chair of the National Education and Planning Committee." And I said, "Oh my God, yes,
Right,
of
like,
course."
don't even
Right?
have to think about it, yeah.
Yeah. Yes. And so myself and Jamie Stevens Davenport were the co-chairs. We were meant to be the co-chairs of 2020. We met in San Diego in January because that's where leadership conference was. We had
Mhm.
this plan because it was the 50th anniversary and
Right,
it was going to be fabulous and
right,
like had this huge plan. It was so great. And then simultaneously I made the decision to apply to Yale for my doctorate.
right.
And it was January and I thought, okay, I'm going to do this. And if I get in, great. If not, it's okay. I had some other things. I had thought about Johns Hopkins and I thought about UNC and their doctor in public health program, but I saw Yale had a DNP. And so I applied, never thinking I was going to get in. And then,
Yeah, because your
um,
resume is, like, really skimpy.
and I mean, I was like, oh my God, I'm never going to get in here. And so then it was the end of February. Within a week, I got accepted into Yale, went and had these really cool pictures made because I was like, I had like a Yale t-shirt and like all the
Right.
things. And I was so excited. And then excited about planning committee, looking forward to like doing all the things with Jamie, my co-chair. And then March 8th came,
Mhm.
March 8th, 2020.
I got married on March
And
15th.
oh my gosh.
Yeah, did
So
not
I
get to go to my
remember,
honeymoon, obviously.
yeah, I remember something like happening in January and me and Jamie sitting at Starbucks saying, "Oh my gosh, this is probably like Ebola.
Well,
Like we're
like,
gonna."
when everybody was saying, "When the ER nurses are scared, I'll be scared," and then we got really scared.
Yeah, and so
Yeah.
then I think about that time whenever I was like, "This is like Ebola. They're gonna make us like dress out in
Yeah,
something.
and then it's gonna be
It's
nothing,
gonna
and
be
it's gonna be, like,
over."
one
Yeah.
person in the country, yeah.
Uh-huh. And then before I knew it, I remember setting up the first check-in station at my main ER and sitting there with a mask on
Right,
and screening people as they came in the door because I was making the process up as it went along, right?
right. And
And it
everybody was
yeah,
making up the process as it
yeah.
went along, and we had to rely on the ENA for helping us with guidance, the CDC, the WHO, the ENA, because emergency nursing, we were all the front lines, but ER nurses, we were the front, you know?
Mhm.
Like, I, yeah, I remember I was just mad because I didn't get to go to Disney World, but I was also, I was I think I posted something in January, like something stupid about like, okay, when the ER nurses are scared, blah, 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 and then I took that down a couple months later because I was like, I didn't,
I didn't know this is what it was
I
gonna
didn't
be.
know. They usually overreact a lot.
Right.
So,
Um,
yeah, that was such an insane time to be an ER nurse.
was. It was a
And
different world then.
yeah, it was really scary to be a newer ER nurse because I had only had 2 years under my belt, and at the
Oh,
time, 2
wow.
years was, like, pretty early in your career, and now you're like a
Yeah.
senior nurse when you're 2 years in, so
I know, isn't that
but
crazy?
yeah, but as a nurse leader, that's a whole 'nother level of stress to be like people are looking to you to be like, "How do I stay safe? How do I keep this away from my family? How do I take care of these patients? What do I tell them?" You have so many things that you have to keep in your purview, and you also had to be aware of whatever the new changes because there were constant changes to
Constant.
either to what how long you could wear a mask, how many times you could wear a mask, like what masks you had to wear, and and uh and then for a while they were letting you wear papper hoods without a mask underneath, and then they were like, no, you should wear a mask underneath because really you're not supposed to be using this thing for this many times, but then you are, and then yeah, and then
It was
there was the whole getting other people's N95 masks back. And they were like,
uh-huh.
"Oh, you'll get the same one," and you get one with, like, lipstick, and you're like, "I don't wear lipstick."
Right.
So, yeah, that was
There's a
terrifying, but, like, not only being on, like, the national level of, like, trying to help people feel safe, but also being, like, your own, you know, nurse leader, like, it's in an organization, that's a lot. I don't think I knew about the ENA yet. I remember my friend Brittany was like, "We should go to the National Emergency Nurses Conference in Vegas." And I was like, "That sounds insane." I was like, "Do you really wanna sit next to me in a bunch of classes? You said you didn't like me when we first met because I asked too many questions in these classes." And she was like, "Oh, yeah, you have a point." She's like, "But we're gonna be drinking." I was like, "Oh my god."
Yeah,
So
it was supposed to be our 50th, it was ENA's 50th anniversary. It was supposed to be out of this world. It was
yeah,
gonna be pretty awesome. And then COVID happened. And then I remember, it's funny you say that. There's a picture of me that I didn't even know people were taking of me walking across the parking lot in front of my COVID tent that I built because I
yeah,
worked like 30 some days in a row, like
right.
straight.
And that's the other thing about being a leader and being a dedicated leader is it's a national disaster, you're gonna
Yeah.
just be there,
Yeah.
you're not gonna take a day off.
I built a tent and a parking lot with all these people. We just did it. It
Yeah.
was insane. But there's that picture of me walking across the tent looking at my phone. And if there's anything that says it, right? It was like, yeah, there's a tent back here. Yeah, I'm walking across the parking lot, and I'm on my phone, but I have stuff on my brain. Like you could tell it was just this thing. And
Yeah.
that was really the rest of 2020 for all of us, I think. And
We
then
were just all in this, we just gotta get through it.
uh
Yeah,
it
but,
was it was the whole thing.
yeah.
And I think that you know, it it changed nursing. We all know that, right?
Oh,
It
yeah.
it changed
Absolutely.
nursing. It changed what we do every day. It was different. And so, uh, we had virtual conference in 2020. So Jamie and I, along with the resolutions committee chair and the president, did fly to Chicago to the headquarters in order to tape the conference. So
Oh, wow.
EN 2020 is still, it was a virtual conference and you can still watch it. And you can see me and Jamie, like,
6 feet apart.
being 6 feet apart from each other,
Right.
like, not wearing masks, but being 6 feet apart, all the things, doing all the things. There's even a picture of us where, we're each on the side of the dining room table and just looking at each other in our dress clothes because we couldn't take a picture together even, It was it was kinda crazy, but it was good, and so we all flew there, taped the conference, and then flew home, and then, 2021 happened, and we were all so excited, we thought we were gonna be together again, and we
The Delta
were
variant.
I know, 3 weeks before. and I had got elected on the board. So that was the thing. So I decided to run for the board,
Mhm.
and then all the things happened, and then I got elected to the board in 2022, right? So that was exciting. And then 2021, it was supposed to be my very first conference as a board member, and it got canceled 3 weeks before.
Right. Yeah. I actually I got COVID in August of 2021.
Ugh.
Cuz what was happening for anybody who wasn't in healthcare at the time was that we were like, it's been over a year, things are getting better, like we're actually going to be able to start doing things again, and then people did start doing things again, and then this new strain started wrecking us, and kids starting getting sick was the thing, is that not a lot of children were getting sick until the Delta variant happened. And so people were like, only old people get it. And it's only the people who have like really low immune systems and blah, blah, blah. And then they were like, but kids don't really get it. And then we started, like, if you were in a mixed ED, you started getting a
Right.
lot of kids in. And then
Yeah.
a lot of people were having a lot faster deteriorations where the ER's full. You have like 3 ER beds that you could possibly work out of for anybody who isn't dying of COVID. But you were doing the proning and stuff in the ER, and
Mhm.
you had to figure out what patients were going to use your OptiFlow machines and which patients were going to use your vents and which patients were going to whatever. I would imagine from a manager perspective, that was a freaking nightmare.
It was.
And I remember not having a very supportive manager during that time, and we were all kind of like, "We understand she's under a lot of stress and stuff," but I think that was a time where I really, really could have used more support, which is why I left, and I was like, you don't give us any extra education, you just kind of expect us to, like, follow along with what you're saying, but not really
Yeah.
encouraging us to learn for ourselves and be part of the process improvement. Because like I like you wanted to be part of making things better, and I was in psych a lot, and I was like, we could do this a lot better, and then they were like, I was like, I'll design it, and they're like, money, and I was like, "Ugh, okay." And then um Amy Cooper was like, "Well, I got this job as a clinical supervisor." And I was like, "What's a clinical supervisor?" And she was like, "It's like a nurse manager that works on the floor." I was like, "Well, that sounds really cool." And she brought me over there with her, and I was like, "Oh, the managers here, they really want you to succeed and grow in your career," because they'd ask you when they talk to you about like how you're doing and stuff, how they can support you and your like career growth. And they'd ask you like, "Where do you see yourself?" I'm sure you made that up that they had to do that, but like, "Where do you see yourself in like 5 years?" and all this kind of stuff, where you're like asking your people that are like new hires and things like that, like, how do we keep you here and how do we support you in your journey? And that made a really big difference to me, and
Yeah.
that's kind of how I saw you as like your nurse getting up on a stretcher and be like, I want to do that. I can do that. That's
Mhm.
what I want to do. It's been insane. Nursing has changed a lot. I've only been a nurse for 7.5 years, and I remember the no pass zones. That doesn't exist anymore. And, with call bells where you, like, weren't supposed to walk by
Oh,
people's.
yeah, I know. They're
Yeah.
trying to reintroduce it like it's new.
Yeah, oh god.
It's pretty funny.
Yeah,
I
no, but
was like,
they don't.
we were doing that a long time ago."
We were actually answering people's call bells. And the whole, like, "That's not my patient" thing, I'm really sick of hearing that because I wasn't allowed to say that when I started nursing. That was
Yeah.
a big no-no. And I've heard a lot being a resource nurse, I heard a lot, Why are you getting involved? Either you don't work here or that's not even your patient." And I was like, "But you're not doing it right." And
Right.
per the research, and people will be like, "Well, it's not policy." I'm like, "Well, it should be." So yeah, that's part of the reason why I went to case management. But always the ER is gonna be where I consider my home and where my people are and where my
Me
heart
too.
is, because it doesn't matter where I am in the hospital or what kind of role I have as a nurse. The ER is what shaped me, and the ER is it's the front door to the hospital. And with so many people requiring it more for more things that they should be going to primary care for, but there's a lot of reasons why people don't have primary care or can't get to their primary care or whatever. We're the we're the catch-all, and they expect us to find them resources that they need, and yeah, we have a lot on our plates, which again is why organizations like the ENA are so important, because you have a lot on your plate, but you can also get inspired to not only know that you can take all that on your plate, but also to see how you can change your plate so you can hold more.
Right. No, it's true. It really is.
But yeah, so you were voted into
The
the
national board in
national board.
2021.
Yeah.
Hmm.
And then you were already serving on the board when in 2022, right? When the first national conference since 2020 was canceled. That's why it
Yeah.
was so crazy. I was so excited that that was my first one that I got to go to. People were like, "This is a really good first conference because we didn't get to have one for 2 years, and now we're just going to go
Yeah.
insane."
Yeah. I mean, it was a really good, that was a really good conference. It
Yeah.
really was.
Yeah, and I didn't you guys do more education than you normally did or something? There was something different about it where it was even bigger and better than it had been in the past.
It was just that, yes, more education. There was a lot of things that, we had that had been building up, right? Just more education, more people. And so it was a really big conference. It was really great. Denver was beautiful. Everyone had a really great time. And that was my first conference in person as a board member. And then, continue to serve. I had at that point, I think, accepted the AVP job at Atrium,
Mhm.
obviously. And then y'all came with us. And so it was just, I mean, it was great. It was a really great time. And then I knew then, after serving on the board, I wanted to be president of ENA. And there's a path, right? Where it's, what is the right path? But you want to make sure that you're doing it at the right time and with the right support. And so I knew then though that that's what I wanted. So I started kind of moving in that direction. So I served my last year. It's a 3-year term whenever you're elected on the board. So
Mhm.
I was serving my last year and decided to keep going. And traditionally, now it doesn't always have to happen this way, but traditionally, you run for secretary treasurer and you become secretary treasurer and then you run for president elect. And then once you're president elect, you serve a year as president elect, which is what I'm doing right now. And then you
Mhm.
serve your year as president and then you serve your year as immediate past president. So,
Yeah.
but it's just been a journey, my career in ER nursing and my career with ENA. I think that they really have coincided really well, and then on top of all that, being able to graduate in 2023 from Yale with my DNP in leadership, healthcare policy. And it was just that kind of like helped me reframe a lot of things and continue to think bigger from various perspectives. And I will say, since we're talking about the gay part, I do want to say
The
that
gay thing.
I think that this is important for gay people as they move through their career, especially if you're trying to move up like I did. Every single job I interviewed for, I interviewed them as much as they interviewed me.
Mhm. Yeah.
And I was very intentional to say things like my partner, my boyfriend, because I wanted to see their reaction.
Yeah.
I wanted to see like
I do
how
the
they
same.
reacted to
I do the
that.
same
And
thing.
yeah, I wanted to see what that was like, because what you don't want is to put yourself in a situation where it isn't good for you or for them, right?
Right,
And
and if you're not open about your intentions as far as, for instance, for case management, I said I'm a huge advocate for the queer community, and then I will say things like "my community," because if you say "the queer community," people are like, "Oh, you picked something." I'm like, "No, it's my community,"
yeah,
and you'll get a look sometimes, or you'll kind of get a nod, or you'll get a, "Oh," sometimes people, especially in a southern state that's, a red state, it's like you'll know when that's not the right fit for you at all.
yeah, you do know.
And they'll kind of be like, if you say, "I want to use this as a platform for advocacy," and they tell you that that's not really what this role is about, then you're not getting that job and you didn't want it anyway.
Exactly.
And so, yeah, I do the same thing. But yeah, I
So
do agree that's super important. Like, as a queer person trying to advance your career, if you are comfortable with it and you expect to be open after you get the job, you should also be open in the interview because, like you said, you're interviewing them as much as they're interviewing you.
yeah, that's true. I guess that would be my biggest piece of advice is as you go through, just being really intentional about that and understanding the environment you're in and really just, being willing to take risks and put yourself out there. I think that in itself is also really important.
And get therapy.
And therapy. Therapy is
Therapy.
always good
Yeah, you can
forever and
always
ever.
use EAP
Yeah,
because your organization will likely provide you with 6 sessions per problem. And so if you have an issue either with, like, discrimination or just being like, "I'm not sure how to out myself to my coworkers," or whatever, like, the therapy is a really, really good tool to help you kind of
I
navigate
agree.
that. We'll also link Gina's Nurse Rescue and the emotional
Really good.
PPE, yeah, and there was other one, For You, I think. Those are all companies or organizations that were put together, like, by healthcare providers for healthcare providers to help them kind of navigate the stresses, and a lot of them came from COVID. I mean, that's just what happens, but, it just to kind of navigate the stresses of being a healthcare provider and having caregiver strain and stuff like that. But yeah, in any field, if you're trying to climb through the ranks and you want to be a voice for your community, then like you said, you got to interview them just the way that they did you. So,
Yeah, it's true.
yeah.
So,
Well, so I mentioned the ENA's position statement on discrimination. I don't know if you were involved in putting together the statement or heard about discussions surrounding putting together the statement, but just kind of knowing once you get to a level where you are able to inform these kinds of decisions, what kind of pushback is there? Is it different when there's more queer people in the room than not? You know what I mean? Like, I am assuming that everybody that was on that position statement team is not queer.
oh
So,
no.
but they know their president is, and they know their incumbent president is. But I mean, even before Ryan was president, I mean, it was still a very inclusive policy. I think the policies from before him anyway. One of them
Yeah,
anyway.
yeah. Mike Hastings, our president in 2020, is gay.
Oh, is he
So
really? I
it,
didn't know that.
yeah. So there has been, even before Ryan and I, there has been, um,
So if you're a gay nurse and you work in the emergency room, run for president.
I mean, well, ENA has always promoted diversity, equity, and inclusion. They were one of the first people to get on that bandwagon
I love
as
that.
far as like this is the right thing to do, right? And as you mentioned, they were one of the first to, share the pride and share the things. And even though they got the pushback, they knew it was the right thing to do, right? Because
Yeah.
they've always been very clear that there's no place for discrimination in healthcare or within our professional community. And the mission itself is grounded in patient safety and nurse well-being and advancing excellence in emergency nursing.
Yeah.
And that in itself doesn't allow discrimination to be tolerated. I think that
That's what I keep
um
saying. I'm just gonna
so
keep saying it until somebody does something about
yeah,
it.
I think that in itself is I think that we've even said it publicly, right? We reject
Mm,
all that discrimination,
yeah.
period.
Yeah,
Um
you're just like, "We don't tolerate it. That's it. End of
yeah.
story. It's just not gonna be tolerated."
Yeah. And I think that the nice part too is what ends up happening is you have a lot of really smart people doing a lot of these things, right? Whether they're
Mhm.
queer or not, whether they have someone they know or not, like they also have the ability to look at things subjectively and objectively,
Right.
right? And see how, even if they have these feelings, whether it be because religion or whatever, there's still the
What's best
objective
for
thought
the
and what's the best for the
Yeah,
association and what's the best for our ER nurses across the world, right? Because
yeah.
we're a global
And
organization.
the
And so
patients we take care of, which is what it all boils down to, is that
exactly.
it's all about our patients. And if you don't
Hmm.
support your nurses and their identities, you cannot expect any nurses to respect the identities of their patients.
Yeah.
So it first starts with respecting each other, and then it kind of, if there's a culture of respect on the unit for between the nurses, there's more than likely going to be a culture of respect when it comes to patients.
Yeah.
So, and then there's the Endeavor Scholarship, which is for diversity just kind of across the board, but it does include the LGBT community. And there, I read the one from, I want to say 2023, where the
Hmm.
girl was talking about how she just noticed a lot of disparities and lack of education, and just how her queer coworkers felt about how about how discrimination was happening and how it was being handled, or if it was even being noticed in some cases. And I thought that was really interesting to read her story and what she did with it. And she basically did a study where I think she got like a survey of trying to get people's um levels of understanding of about the community, and then trying to figure out where to go from there to make it better. And then hopefully I get Brian Martinez on here, but he in March of 2025 he was published in the Journal of Emergency Nursing, and he's from Florida, and he did I think in an Adventist hospital of all places, posed a new education and like training surrounding the queer community. And he put this on his unit, and people took the classes, and they had a much better understanding about basically like what queer people, but specifically like trans and gender diverse people, go through in the emergency department, and how important it is to, it doesn't matter that it's an emergency, you should still be respecting their names and pronouns, and it's not something that you don't have time for, and it's not something that can be ignored. Like, yeah, you do need to know their legal name, and you do need to know what organs they have, but there's a
Yes.
respectful way to find that out and to support that patient. And
Yeah.
even just, it goes so much further beyond how you talk to the patient and how you address the patient, to how you're talking about it at the nurse's station, how you're talking about it, or the fact that you're even talking about it at all at the nurse's station. What are you talking about? Right. But, and then they did update the trauma guidelines to include transgender people as a special population, to include it in the, not TCRN, what's the other one? TNCC, because there are things like, the potential of being pregnant, or if you've had your Adam's apple shaved down for like feminization surgery, like those types of things. You're going to be a difficult intubation probably if you've had surgery on this area. If you are able to become pregnant, there are other precautions that we need to take. We have a responsibility to protect all patients, and learning about different groups of people is incredibly important. And I've learned a lot more about Jehovah's Witnesses recently, actually, because there was a chaplain that came to the hospital, and the patient was going to get a surgery, and it wasn't like he needed blood or something, but in the event that he did, the chaplain brought this whole like book about
Yeah.
like what he could have and what he couldn't have if there was nobody to speak for him. And it went into like all this detail about like what you could give people in emergency situations if they did not have somebody to speak for them. And it was really nice to be like, I'm not religious at all, but I said, this is education that is important to a patient group, and I don't agree with it. I think that if you need blood, you need blood. However, I'm not going to ever make that decision for somebody else. I think
Right.
that when it comes to pediatrics, there's a lot more involved with the ethics of keeping something like life-saving blood products from a child. But that's why the ethics committee's there, and that's why they get involved, and they kind of help discuss, is it unethical to save this child's life, and they're not even the one making the decision, those kinds of things. But to speak about ethics, most hospitals have I would think every hospital, but I'm not sure. The hospitals that I know about have ethics committees, and I found out from my friend Beverly that I interviewed that chaplain staff the ethics board. So if you ever have a question about ethics or discrimination or anything that you're like, hey, is this an ethical problem or something? You can go to a chaplain if you don't feel comfortable doing a report or something like that. And you can talk to the ethics board. You can make a report directly to the ethics board. You can be anonymous. You have to share your information, but they can't share your information if you say you're anonymous and things like that. But on top of that, so if you have an ethical concern, like I said, you can go to your chaplains and things like that. But also any hospital that's accredited by the Joint Commission is also under their anti-discrimination umbrella. So the Joint Commission has a pretty strong stance against discrimination. And I know we don't really like the Joint Commission, but they are our regulatory body. And if they're going to be telling us we can't have drinks at the nurses station, they might as well address the ethics problems. But yeah, so like 80% of hospitals or something are accredited by the Joint Commission. So if you have an issue that isn't being addressed by your hospital, you can always go to the Joint Commission. If you feel personally discriminated against, or you feel like a patient is being discriminated against, those are tools you can use. But you can also
Yeah.
reach out to ENA has like an advocacy group, and they do Day on the Hill where they go and talk to legislators like up in Washington, D.C. And the no tolerance for violence thing was an ENA.
Huge.
It was an ENA driven thing, so it didn't used to be a felony to assault a nurse, and now I think even verbal assault is covered under that in some cases. But that's huge because I've had magistrates laugh in my face for trying to report things. So but now, you have these people that are out there trying to protect you and say like, you're putting your life on the line to save other people's lives. You deserve so much more than to be afraid at work. And if something does happen at work, you deserve better than to ask what you could have done better and what nonviolent crisis intervention thing you could have done.
Yeah.
So,
And, ENA we do continue to advocate for the workplace violence and for our ER nurses. So I
mhm,
think that, I mean, that's really that's what we're here for. That's why I'm here as a nurse leader too, right? Is to
yeah.
advocate for others and ensuring that they have the resources dependent on, where they're at. And I think that that is part of our job as leaders.
Yeah,
So,
absolutely. And if you're a queer person and you're working in healthcare and you don't have anybody that you know who works with you that's queer, get involved in a nursing organization. They're there. you know? And the ANA, even the American Nurse Association, has a very robust anti-discrimination policy as well. And they have their own conferences and things like that. So, I mean, even not just the ENA, but the whole national. And
the
then the
nursing
American,
community, there's all different kinds of associations based on your specialty and your interests. But I think the nursing community in general has that really strong anti-discrimination.
yeah. Well, we're supposed to be the most trusted profession, and we can't do that if we're doing unethical stuff. So,
Exactly.
and then the American Academy of the colleges of nursing or whatever also is very anti-discrimination. Um, if you need somebody to look up to and you need a queer like nurse mom or nurse parent or whatever, go to a like national committee or something, and you'll find somebody in your corner. And then just kind of, seek those people out. And when you find them, find out where they came from and what they can offer you. The people like that are people who keep that fire under you lit. If you're having a hard time with something or you're not sure where your career is going and stuff like that, to just go to your people who are where you want to be in 5 years and just be like, hey, like, help me out, like, can you help me work through some stuff? Like, I've taken stuff to Dustin before where I said like, I'm frustrated that this didn't get put in a conference, or that that this wasn't taken on as whatever, and can you like help me look over this so I can try to make it better for next year. And I've gotten a lot of support from you over the last few years that I've known you, and I just want you to know how much I appreciate it. And
Oh,
I hope that other nurses like me can find nurses like you to help them just be better versions of themselves.
Well, I hope so too. And I'm glad that I was able to help you. And I'm glad I was able to be here and tell a little bit of my story. And
Yeah, me too.
hopefully somebody resonates with it.
Yeah.
So,
Yeah, I hope so. I think just hearing, like you said, going on LinkedIn and seeing where people started and where they are now, I think that seeing people who are like you in positions where they're actually able to affect change, I think that's a huge, I can do this. I still want to be here. This is something that I can work towards, and just kind of help people know that there's hope even in the darkest times,
yeah,
and that we all just got to be here for each other.
I agree.
All right. Anything else you want to share, like where to find you on socials or
Yeah, I
just
mean,
watching
I'm on
from LinkedIn?
LinkedIn. Yeah, I'm on LinkedIn. DBAS1986 is my Instagram. I mean, feel free to come say hi to me on LinkedIn or Instagram. I'm there, and just letting everyone know that it's not about being perfect, it's about being authentic.
Yeah,
And
100%.
we're stronger together. And I think that our strength comes from community and lifting each other up and helping each other and making space for us. So,
Yeah.
but other than that, I appreciate you having me on here.
Oh, I'm
So,
so glad you were able to come. All
yeah.
right, I'll do my little outro and then I'll let you enjoy the rest of your evening.
Okay.
All right, and that's what he said. Have any titillating topics for the future? Still have burning questions about today's discussion? Feeling frisky and now you want some action? Slide into my inbox at smutdidyousay69@gmail.com to find out how you can get in on this. And follow Queerlina for links to education and resources related to today's topic and updates about our next show. Good night, my little smut-heads. Thank you, Dustin.
Thank you.
Thank you for listening to Smut Did You Say? You can find links and resources mentioned in this episode in the description below. For a downloadable PDF of Nikki's resource handout, along with additional emergent support options for queer individuals, visit queerlina.org/helplines. That's queerolina.org/HELPLINES. Take care of yourselves and each other, and we'll see you next time.